This is your Houston chiropractor, Dr. Gregory Johnson. We have Tyler in here with us this afternoon. This is Tyler's very first visit here to Advanced Chiropractic Relief, and he was referred here by another patient who came here previously who had severe lower back pain and leg pain. And just so happens that's exactly what Tyler has going on right out of his right SI joint region that goes all the way down into his butt and gets tingly sensations down into his right lower extremity. He also has compensatory tightness and pain up in his mid and upper thoracic spine. He has numbness and tingling sensations down his thigh, and he's been diagnosed with a L5-S1 disc bulge, and I just looked at his MRI and read the report on his MRI that shows that and confirms that he's got a osteophytic spur coming off of the L5 vertebral level. That's degenerative disc disease or degenerative joint disease, osteoarthritis. Those are all synonymous terms. And this is affecting your life quite a bit, isn't it?
Yes, sir. It has for quite some time.
Yeah, this has been going on for over a year, you told me.
Yes, sir.
And then you had back surgery all the way back in 2012.
Yes, sir.
In November of 2012. For the same issue, basically, only more severe at that
More
point.
severe. My disc had basically exploded.
Yeah, herniation.
Herniated.
Yep.
To a pretty bad degree.
Okay, so I was just pointing out a couple of things on your posture there, but go ahead and just relax your arms down and then close your eyes and bend your head forward and backwards for me, please, and then back to neutral with your eyes closed, Tyler. Okay, so when you open your eyes, don't move, just look in the mirror, and you can see from my pen out here that your ear's dropping right here over your clavicle. It should be back here over your shoulders. You see how your hands are out in front of you?
Yes, sir.
They should be at your sides, and you should be squared off more like that. Have your head up over your spine. But down here, you've got less room on this side than you do on this side, so your pelvis has translated to the left on the x-axis. We call that a positive SX pelvis translation. And because your head's forward to the right and your pelvis is over to the left, your spine is compensating, which gives you a curvature in your spine. That's called a scoliosis. Now, I've already done his orthopedic neurological examination and his history, so I'm just going to get to adjusting him for the very first time here at Advanced Chiropractic Relief. You've had other adjustments before.
I have, yes, sir.
Okay, let's go on. You tell me here. I warned Tyler before I even started doing anything that I was an old-fashioned bone mover chiropractor. Left leg's coming up a ½ inch short down here in this prone position. However, when I lift his legs up and bend them up, the left one gets a little bit longer, about a1/4 inch, and that tightens up in your lower back and thighs a little bit, huh? Especially right here in this right SI joint area in the back.
Yes, sir.
And then he's got pain upon palpation down here in his right SI joint, but mostly right down here at L5-S1 right there, huh?
Yes, sir.
He's got muscle bundles down here, which are muscle spasms. And you can feel the scoliosis through his thoracic spine right here. If you watch my fingers, you can see my hands curving like a snake. He's got a lot of ribs out of place in his mid-thoracic and upper thoracic spine. His cervical spine, he's got C6 and 7 palpating out to the right. C4 and 5 are way right. And his atlas is also subluxated out to the right there too. We did a sacral deviation test on him. Go ahead and lift your right leg up again, please. And do the same thing now with your left one. And you said it was more difficult to lift the right one up, right? And it hurt more?
It just, when I
Or the left one, but it hurt on the right.
It hurts on the right.
Right. So he has subluxation complexes in his sacroiliac joints, sacrum, lumbar spine, thoracic spine, rib cage, and cervical spine. And that's what we do as chiropractors, adjust biomechanical improprieties of the spine and the extremities. Some chiropractors do that, I do. So if you're okay with that, I'll go ahead and give you your first adjustment. Okay. So all you gotta do is lay there and breathe and relax. You get the easy job. Okay. I'm gonna adjust your sacroiliac joints first. There. I'm I'm going to adjust your sacrum, which is your middle triangular shaped bone in the middle of your pelvis, straight superior to inferior, away from L5. And then I'm going to adjust L5 straight P to A so that we can push these vertebrae back forward and get them off the nerves back there. Yes, sir. Keep breathing. Yep. Mm-hmm. There we go. Good. So far, so good. Looky there. Imagine that. Legs are exactly even now. And Alex, this should feel a little easier this time. See, they stay even too. Did that feel any easier than your first one?
Yes, sir.
Okay. You're going to feel your hip popping up a little bit on this next one. There we go. I'm going to put the curve back in your cervical spine. I don't know if anybody's told you or not, but you've got a decreased cervical curve as well. There you go. Good. Okay, let's turn you on your back now. Have you seen our YouTube videos?
I have.
A little different person, huh?
Yeah, it's a little bit more hands-on.
Yeah, big time. It's hard to adjust through the internet. Slide down this way a little bit. But you'll be able to watch your own video on YouTube now and still get relief from it from your mind.
Yeah.
Because it creates a chemical release in your brain.
I'm looking forward to that.
Put your arms straight out to the sides for me, please, sir. Okay. He's had surgery on this right AC or left AC joint as well, but I am adjusting those joints because they have fibrotic adhesions and scar tissue that develops after you have those surgeries, and I want to get maximum movement in all his joints. You can put your hands on your stomach for me there, and just let me have you here, Tyler. There you go. Should have felt that from your knee all the way up to that lower back.
Good Lord.
Did you feel that right up in that right
I did.
side?
Yes, I felt it.
Okay, keep breathing and relaxing. There you go. Super. Okay, we're going to set you up sideways and face that away. There you go. Scoot back this way just a little bit, please, sir. And just let this relax in my hand here. Yep. Don't be worried about this shoulder. I'm not going to hurt it.
Okay.
There it is. Crack Guy's gonna love you too.
Yeah.
You didn't realize you were out in all those spots, did you?
No. Sounds like I'm pretty
Sound like a
messed up.
bowl of Rice Krispies.
Yeah.
I'm just pouring on the milk. There we go. That's what people come here for, is for me to pour on the milk.
Yeah.
There we go. Okay, now for the big one. Yes,
Is this the
ma'am.
ring dinger?
This is. No, you're fine. Honey.
Okay.
Better actually if you sit there. Okay, butt right here for me and head up this way, please, sir. I'm glad to see you not sitting on a wallet. That's a good first. Most of our new patients today, I've had to tell them to quit sitting on their wallets. Okay, this is gonna feel tight, and it should. There we go. Just let your legs relax and bend naturally with the table. You can rest your hands right here on your stomach for me. And I want you just to keep your teeth together. You don't need to grind them or clench them or anything. Just keep them together so you're not biting your tongue. Okay. Now, I want you to breathe through your nose with your left ear. There you go. Long run.
Oh.
Brave.
What was that?
Oh man.
Yeah, you relax your head in my hands here now. Okay, let me do the work. You just think about something else. Wiggle your left toe. There you go. Now wiggle your right big toe. There you go. Yes, sir. You have now had your first full body Johnson chiropractic adjustment.
Did I just get ring dingered?
Yeah.
Oh yeah, big time. Most people don't have to ask me that. They know they got ring
I
ding.
can feel it.
Okay, turn sideways and push yourself up with your left arm. And we're gonna stand right here in front of the mirror. If I did a ring dinger on somebody, they had to ask me if I did it on
Well, I
them.
didn't, if that was the infamous ring dinger, I just didn't know if it was.
That's the infamous ring dinger.
one.
Okay, let's have you flex your head forward and backwards again. And watch the range of motion already. Watch how he's standing up now already. See the difference? He's taller already. Look at the spacing now. See how it's evened out more?
Yes, sir.
So your shoulders are still, your head's still a little forward. It's not as far right as it was before. So this is your homework. Pull these up and back. Flare these back here.
Just got that down there. You want to say it?
Bring your head straight back. Translate right. And then look backwards at the wall behind you. Full extension. You're going to feel a little tap on your atlas right there. Another one right there. Okay, relax now. All right, Tyler, I need you to flex your head forward and backwards again. This should feel like it's got WD-40 in it now. Should feel smoother to you.
Yeah.
Look at that. Back to neutral. Take a look in the mirror now. You're standing up like a military man.
How about that?
Look at that. Spacing's evened out.
How about that?
Yes, sir. Walk around for me and tell me how that right SI joint feels now compared to when you walked in the door.
Feels a lot
Now,
smoother.
you're going to be sore from your first adjustment, so expect that over the next 72 hours.
All the burning sensation I had in my up here, my upper back's gone.
Great.
Feel pretty loose.
Yep.
Good.
Lighter.
Yeah. Yes,
Yep.
sir.
Just keep your chin up and head up over your shoulders, because that's what causes all this extra weight bearing down your spines when your head's forward. That's
Okay.
called forward head posture. So when you see him doing that, just remind him, slap him upside the head and tell him it's for me.
Okay. Gotcha.
And if this gets too sore over the next 72 hours, which it may get sore, like a new workout type soreness, you know how it
Understood.
feels to go to the gym
Yes,
for the
sir.
first time
Yes,
and
sir.
work out and get sore?
Yes, sir.
That's what this might feel like. So put crushed ice in a freezer baggie directly on the skin over anything that gets sore.
Okay.
And do that for 20 minutes at a time. You can do that every hour if you need to. But it has to be crushed ice in a little plastic Ziploc freezer baggie, not these frozen peas or gel
Sure,
packs that you throw in the freezer.
Okay.
Use
Gotcha.
crushed ice on it.
Crushed ice.
No heat on any of this.
No heat.
That old thing about alternate heat and ice is a bunch of bull.
Okay.
Ice, crushed ice only
Okay.
is state-of-the-art sports medicine.
Understood.
Sounds simple, but it is.
Okay.
Other than that, I want to follow you up next week just to make sure you're doing okay.
Yes, sir.
And then after that, you just call and come in when you feel like you need a tune-up. Does that work for you?
All right. Only if
So-
you rain dinger me. Like
Oh,
that.
I'll be ring dingering you every time. So what would you tell to our crack addicts around the world about your very first time ring dinger? Because
The
everybody
ring
always wants to
dinger,
know what the
it's-
ring dinger feels like the first time.
There aren't really any words I could really put that on. Just instant relief and just a kind of a cooling sensation running down your spine, and just extremely. As soon as I got up, I just felt, I don't know,
You
10
immediately
years,
feel better,
10
don't
years
you?
younger, just like I've never had a problem. But if anybody's ever been through it like me, gone to different people and looked for relief and haven't received anything, I highly recommend that, because just after one session standing here, I feel 10 times better than when I walked in.
That's great,
So-
man. Well, thank you for sharing that
Yes,
with
sir.
everyone on
Appreciate it, Mr.
YouTube.
Johnson.
This
Dr.
is
Johnson.
your first YouTube ring dinger ever.
Yeah, I feel good.
Yep.
I really
That's
do.
good. Yep. Good. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief, where we do ring dingers on patients' spine to alleviate compression stress on the Y-axis. We'll see y'all soon.